Many people have the perception that all stem cells come from the unborn, and that in order to harvest the healing property of these cells, a yet-to-be-born child must be sacrificed. These are known as embryonic stem cells. The whole idea of taking life from one being to give it to another makes many people uncomfortable, me included. It raises serious moral and ethical questions. The good news is that stem cells can be harvested without this concern. That is, the best stem cells, the one with the most regenerative and reparative properties, as well as the fewest complications, are adult stem cells. These cells can be harvested from the umbilical cord of a live, healthy baby or the patient's own bone marrow or fat. There is no controversy. Both the Baptist Church and the Catholic Church have endorsed the use of adult stem cells. There are many more differences between embryonic stem cells and adult stem cells, far too many to mention them all. To boil it down and to easily understand the principles, embryonic stem cells are very early in development, and they're trying to make a baby, not to heal an injury or a disease state. More importantly, there has never been a successful clinical trial using embryonic stem cells. Adult stem cells, on the other hand, are designed to repair, restore, and regenerate. They have the ability to differentiate into many different tissue types, communicate, and actually transfer data to the patient's own cell. They're also immunologically privileged, meaning the immune system does not recognize them as foreign. Their primary purpose is to maintain normal physiologic function, decrease inflammation, and stimulate regeneration. Another great quality, as they start to differentiate into new tissue, they also lose their stemness, become recognized by the immune system, and then are gently cleaned from the body. However, before this happens, they will have released tiny packets of information to act on the patient's own cells to decrease inflammation, as well as regenerate areas of injury. Where do we get these stem cells? As I stated before, adult stem cells can be acquired from the patient's fat or bone marrow. Unfortunately, as we age, like any other cells, our stem cells begin to die off at an alarming rate. By the time you're a teenager, 90% are gone. 30 years old, 96% are gone. 50 years old, 98% are gone. And by the time 80 years old, 99.5% are gone. Unfortunately, the ones that live have much less regenerative capabilities. A stem cell harvested from a middle-aged person and placed in a petri dish will produce about 200 to 1,000 cells by the end of a month. A stem cell harvested from a newborn umbilical cord will produce over 1 billion cells in the same scenario. Not only are umbilical cord stem cells more potent because of their ability to divide, they also possess the ability to secrete a much broader range of bioactive molecules to aid in regeneration. Umbilical cord blood has vast quantities of stem cells, as well as other reparative cells, and is easily obtained. Fat and bone marrow-derived cells have less quantity and quality and require a surgical procedure to obtain. Of all the stem cell procedures done in the United States, only about 3% use umbilical cord stem cells, despite the overwhelming advantages.